Southern Plains Medical Center presents your hometown medical minute, and your host, Hal Brock.
Hey everybody, happy Friday and welcome to our podcast, Your Hometown Medical Minute. I'm your host, Hal Brock. With me, as always, behind the cameras, our IT director, Mr. Ed Harrison. So Ed made it through another busy week with some nice weather to kind of end the week with, and that looks like it's going to roll right through the weekend. So a good chance to get outside and enjoy this beautiful Oklahoma spring weather. Had a good weekend last weekend, though, over Easter weekend. Had a lot of family in town, so looking forward to maybe a little bit more quiet weekend and a chance to maybe get outside and finish up those last touches on the yard. Very interesting show for everybody today. Southern Plains Medical Group CEO Len Lacefield, he's going to drop in and he's going to sit down with me, and we're going to take an in-depth look at the information he's going to be sharing and discussing at our town hall presentation next week in Pauls Valley, next Tuesday, April 30th at Mimi's Restaurant at 6 p.m. The Southern Plains Medical Group invites you to a town hall presentation and Q&A session regarding the Pauls Valley Hospital, Tuesday, April 30th, 6 p.m. and again at 7 p.m. Mimi's Restaurant, light snacks and refreshments will be served. So join us next Tuesday, April 30th at 6 p.m. and our CEO, Len Lacefield, for our town hall presentation regarding the hospital. Hey, so some great information going to be shared here today. Of course, next week it's a Tuesday, so we realize not everybody's going to be able to make it out. So I definitely wanted to have Len come on the show today to have this platform to be able to share some information on. But, you know, this is a really hot topic, Ed, in rural healthcare, as more than 600 healthcare facilities across the United States are in danger of closing here in the next 3 to 5 years. And right here in Oklahoma, 3 to 5 community hospitals, additional ones, are looking at closing over the next couple of years, and we've had 4 or 5 over the last 5 or 6 years closed down. So before we bring him on, just to give you a little background, CEO Len Lacefield, been here since 2014. He's a graduate of Oklahoma State University, go Pokes, and then went on and obtained his master's degree in business administration and then another master's degree in health administration. He has more than 35 years as an innovative leader here in healthcare in Oklahoma and has grown Southern Plains to 3 new communities, including Pauls Valley, as we just mentioned, with Dr. Susan Jones, Dr. Kim Jones, and Dr. Tammy Jarvis. Here is SPMC in Chickasha now offers more than 17 medical specialties, including several surgical specialties and vision right here in Chickasha. So he's done a tremendous job changing not only the culture, the atmosphere, but man, he has assembled such a great, loving, and caring team. I truly feel incredibly blessed to work alongside these great folks on day in and day out, truly selfless. Hey, anybody that comes to work on a daily basis with their sole interest in making the sick and injured of their community feel better or just smile, man, these are some wonderful, caring people. And Len, so without further ado, Southern Plains CEO, Mr. Len Lacefield. All right, I'd like to welcome our guest, CEO of Southern Plains, Mr. Len Lacefield. Hey man, thanks so much for taking your time. I know you're busy, so thank you so much for giving me like 5 minutes, man.
My pleasure, Hal. Thanks for the update.
Absolutely. Well, you know, our social media team this week recently put out there about you're going to be in Pauls Valley next Tuesday night and kind of doing a presentation in regards to Southern Plains plans for the Pauls Valley Hospital. And so I wanted you to kind of expand on that real quick for us, if you wouldn't mind, just what's going to go on.
Sure, Hal, my pleasure. You know, we have worked for the better part of 6 months with city officials and state officials, including local physician offices. We've been able to partner with a number of them.
Right.
They're part of Southern Plains now. So the entire effort was to restore health care to the community.
Okay.
Hospitals got to be there. we have to do that. So there's just been some unique challenges.
Okay.
In regard to restatement of the license and evaluation of the facility once a license is reestablished.
Okay.
But clearly we know and can define that emergency services, laboratory services, radiology services, and forward-thinking restore outpatient surgery to the facility
For sure.
and to the community is our number one priority. So I think that really the purpose for Tuesday night is we're at the point where we have filed all of the required applications, paperwork, and transitional requests for the
Okay.
license to fall under Southern Plains. And now we feel like it's time for the community at large to express themselves. So there's no better way to express themselves than through a petition.
Absolutely.
So the presentation itself will just be a very transitional statement as to where we are and where we think we're going and the needs. But by and large, it's just simply going to be very transparent about what we're trying to get accomplished and the fact that we need an outreach from the community.
Yeah, for sure. And you mentioned the license, and obviously Pauls Valley has had a hospital since 1970. So, I watched your interview with Jackson Bolin on K10 News out of Ardmore the other day. Jackson does a great job. You did a great job.
Thank you.
But I did hear mention that goes along with all hospitals, all healthcare. They have a number that's assigned. And so, can you kind of explain where the license is?
Well, when any facility has their license either suspended or not renewed,
Okay.
then it goes into, you might call, just a pending status. So currently, the license renewal was it's an every 2-year process.
Okay.
So when the data was sent, or the request was sent for renewal, because the transition of the hospital was in prior to closing,
Right.
either it wasn't sent. In some regards, we were told by the state it wasn't sent, or in fact, perhaps it was, but no one received it.
Okay.
Either way, the renewal wasn't accomplished.
Okay.
So it is. We've accessed the number, and we have filed an application for the reenactment or the reinstatement of the hospital under that license. Now, every
Okay.
healthcare facility has an assigned license number
Right.
for the state.
Okay.
And that's all we're talking about. Pauls Valley General Hospital has a number.
Right.
And that numeric number is what the state identifies with their license. So that number is still there.
Okay.
It still exists. And so all we're asking the state to do with the application and the responses that they've asked us to provide, that being a lease from the city and our intentions of narrative and so forth, is to say, hey, it was operating just fine
Just
up
October.
until the end of November.
Okay.
When the license requirement of the term would be renewed,
Right.
which is a very simple process. It was operating with no penalty under CMS or the state. So our question to them is, well, then why can't you just reissue the license under our name? We filed the application, we paid the fee.
Right.
The city is ready to have the hospital back for services rendered. People's lives are at risk on a daily basis. So that's kind of the status of it.
Okay.
It's ready, and the hospital by and large is ready. Now, the other caveat to this, if the state chooses not to allow us to operate on the existing license and the current status of the state's regulations for the hospital when it was not renewed,
Okay.
then we're posed with significant issues on the 2019 standards of healthcare facilities and their
Gotcha.
operation.
Well, because obviously there's been updates through federal stuff, but we're talking about a hospital that was literally 5 months ago was in operation. So,
Fully operational.
and it wasn't being hit by any penalties from any of the federal government. So it's not like a dilapidated building.
No.
You can go in there with minimal cost. You're a business, so you're coming in there bringing your resources into the community.
Right.
But that enables you to get started sooner. Correct.
Well, much sooner,
Okay.
much more economically.
Right.
The standards today, as you might guess, through any bureaucracy, don't really make sense regarding the street level need to provide patient care. Currently, because the facility and plant property was doing that effectively, if we're able to usher in under the 2018 pre-November 30th non-renewal date, then we can simply go in, reevaluate the mechanicals which were operational
Right.
functional, reassign the serviceability and workflow for patients, and we obviously have the staff and partnerships to do that.
For sure.
The remuneration through CMS and things, it's intact for at least a year when a facility it goes to pending status. So that in and of itself is a blessing.
Yeah.
Everything is in order except that single letter from the state. So if we did that, our timeline might be 60 days.
Oh, wow.
If we don't do
Wow.
that, our timeline may be 60 months. I mean,
Oh my gosh,
it's
okay.
a difference of, well, let me just put it to you in plain English. It's an issue of life and death.
Yeah.
The hospital lives or maybe doesn't. Patients
Yeah.
live or maybe don't. And I hate to say that so directly, but without the hospital, you can ask the community, people are suffering.
For sure. And the fact that it was running and it's good, you could literally go in, open it up 60 days. It's going to have the same functionality as it did in November, but going to just in those 6 months and the changes in the year, it would cost like $3 to $5 million. And at that point, the way rural healthcare and healthcare in general is going, I am under the assumption with technology that building's fairly large. I mean, at that point, with that kind of money, you'd really have to kind of evaluate whether that's the still right opportunity, or maybe building something new and smaller would be more feasible with Southern Plains resources.
Based on the outcomes of our efforts, we've got to find ways to address delivering healthcare in the community.
Right.
And let me just digress a minute on what you just said.
Okay.
When a facility is struggling at an old business model of 65 beds,
Yeah.
then there's something that has to change in the business model. We absolutely know that emergency room services have to be restored.
Right.
We have to address ambulance services for functional and supportive of even our physicians' offices off campus. We have to address radiology.
Okay.
We have to address laboratory services.
Diagnostics.
Exactly. And we need to evaluate our operating room systems.
Okay.
What can we do in the community to support and sustain? We will not address filling the 65-bed hospital before we address the urgent needs of the community.
Right.
And then we'll discern through resource management and through just determining what services need to be rendered. How do we do that? The building is in good shape.
Okay.
The building is usable under
We're
pre-November 30th, 2018 standards.
Right.
But the fact of the matter is, it's very functional for the purposes of what we might initiate, which meets a significant need of the community and surrounding areas. Probably some 30,000 people in that marketable area that would outreach and use that ER services. Lindsay, for example, Sulphur, maybe as far south as Ada, if they're closer to Wynnewood, the plants, the Walmart distribution
Davis.
center. So it is an incredible need.
Yeah.
And we would go in and re-establish a different model. We're community. We're rural healthcare, as you mentioned in your podcast. We're their hometown medical team.
Well, we've been in Chickasha since 1915.
It's been a while.
Yeah.
3 years, July.
Yeah.
So Pauls Valley has needs the same services, outpatient and inpatient. So in doing that, we're just going to be another hometown team. We're not a management company from afar. We're a healthcare system that we live and breathe the same things and the same services that need to be delivered through the hospital in Pauls Valley. And we consider that an honor and a challenge to partner with this community.
Absolutely.
Wonderful people.
Yeah.
Super base of all types of healthcare needs that we can support
for sure
locally.
For already there that have been in the community and can definitely help that.
Yes.
And going into Pauls Valley, how do you kind of address some of that history?
Well, it's not unlike the history we've addressed here at Southern Plains over the last 5 years. It's it's the old saying that the truth will set you free.
Right.
And quite honestly, none of our team walked through the history of Pauls Valley, so I can't address the decisions that were made, what had happened to healthcare, why. No, a very few people actually know, and perhaps there's no one that knows the full value of it. The truth of the matter is, rural healthcare has suffered for probably 2 decades, if not more. The needs not changed necessarily.
No.
Technology's changed, management's changed. Maybe you have to change. So historically, I honestly can't address what's happened. It
Right.
wasn't part of our team. It wasn't part of our leadership. But what I can tell you is it's a fine facility and a great need.
Absolutely.
And that's where
Absolutely.
we're forward thinking, and we can anticipate, and hopefully because of our involvement and the things that we've been able to do in some of the of our own systems over time,
Oh, man.
and the
Yeah.
leadership, ownership involved in that, and then experiences that we have with myself and you and other leaders, well, I think we can do a fine job.
Absolutely. I do
You know,
too.
the
I do too.
community itself is, I'm just amazed at the heart of that community.
Yeah.
It's phenomenal. You know, the Chamber of Commerce with Sherry has been exceedingly supportive. The city management, city attorneys, the hospital trust board, just to hear their heart. Now, it removes them from the day-to-day struggle of what happened.
Yeah.
I don't know what happened.
Right.
But what I do know what's going to happen is we're going to have a position in Pauls Valley to service the surrounding areas at the highest level that we can involve ourselves with that makes sense from a resource management issue. But the bottom line is there's patients that need care,
Yep.
and we're engaged, and we're going to do what we can to offer services that are required for that community and be a part of the community that we serve.
And what you've done here at Southern Plains, not only have you just grown inside Chickasha, which we now have more than 17 specialties right here in Chickasha, which is a 45-minute drive from Pauls Valley, but you've also now got a multi-specialty clinic over in Anadarko. You produce surgeries over in Anadarko through many specialties in an outpatient setting. You're down in Maysville, and then you mentioned Pauls Valley. And we are working with two of the most coolest doctors that I've gotten the pleasure to meet over there, and I spent yesterday with them, Dr. Susan Jones and Dr. Tammy Jarvis. So you are there. And so what are your next steps with this town hall meeting? We're looking for signatures. What are your kind of next steps?
Well, I think we anticipate an exceeding amount of support.
Yes.
I think we have been received well.
Yeah, I think so.
I think our transparency and those who we've worked with when they've gotten to know us, they recognize that we're part of a team for restoration. So the plan would be is to share where we're at, much like we're doing here in this podcast, in the process to reestablish the license.
Right.
And then beyond that, depending on how quickly we can get the license reestablished, move forward to re-equip, reassess, and reopen the services. The core need on Tuesday night and throughout our network facilities
Right.
in that market is to have as many signatures from our residents, our business leaders, our community leaders, anyone who has an interest of seeing Pauls Valley Hospital reopen, which should be everyone in the serviceable market.
Absolutely.
Those signatures will be then taken forward to the state departments. We have already made contact with Governor Stitt's office and the new healthcare cabinet leadership.
Okay, cool.
And some of our other legislative friends, as you know. And we have, Perryman's also comes to mind, Emhoff. So we have significant support of our legislative branch.
Yes.
Now, if we, after Tuesday night, we get the support from a petition base, because we really can't fight a fight if the state doesn't understand there's a fight to be fought.
Right.
And so if we get the community support on Tuesday night, we take those signatures up as early as Wednesday and say, here is our plight, here is our need. There's absolutely no reason that hospital license should not be reenacted today.
Right.
Applications in, fees are in. And at that point, we'll know exactly, we'll be able to put on a timeline
Okay.
as to what we can anticipate. Ownerships and support, resources have already been established. So we just have some work cut out for us in this, but this is something that's out of our control to identify community support.
Absolutely.
So
Yeah.
that's all we're doing. And beyond that, we can't address what's happened historically. That's a battle or a situation. If any of it's still embering,
Right.
that needs to stay there.
Yeah.
What we're focusing on is Tuesday night.
Okay.
Is support of our physicians on the ground, as you mentioned, Dr. Jones, Dr. Jarvis, Michelle. We've got Cindy there
Rowe,
now, one of our
yeah.
new representatives.
Right. Yeah.
Highly visible, super strong leaders.
Yes,
Lindsay,
definitely.
we affect that. And then, of course, Casey Watley in Maysville.
Yeah.
And then Kim Jones, in his own practice
Absolutely.
there. a significant foothold for service. But as we draw it all together through public support, I think then the true restoration process can begin as we unify healthcare in that community and identify what services needed to be restored, and quickly and swiftly allocate resources and staffing to make sure that happens.
And you're talking about community support in the state. It's a big story, Pauls Valley, but the state's got 77 counties, a huge, we're 48th ranked right now in state healthcare. They've got their hands full. They've got 5 other hospitals that are looking to shut down that are also reaching out for community support. So this is a big story for people to come out and support, other than reissuing the license that was working in November. It hasn't been that long. You're bringing in the resources. You're not asking for anything additional as far as monetary resources from anybody.
No, we're not asking the city to fund our efforts.
Right. Okay.
We're not asking for a handout. We're asking for an opportunity to offer a helping hand.
Yeah, which you're very good at, Len. Everybody, I had somebody, a new member of Southern Plains Vision Associates, tell me a story this morning that they had gone to another facility and they came back here, and it was a family atmosphere, and they had this caring, loving nature. And I see that day in and day out with your crewmen. They truly do. They're selfless people. They care about the people, the sick and injured of the community. Thank you for all you do.
Well, it's a privilege to serve, and as the leader, I deserve very few of the accolades. It's the team that are out on every one of our markets that are having interaction with patients minute by minute.
Yeah.
Every phone call, every patient visit, it's up to myself and you and other leaders to equip the boots on the ground.
Yeah.
And then the great thing about a Pauls Valley market is it's the same scenario. We have these clinics in place that every day we answer phones, we care for patients, we refer, we treat, we diagnose. And to be able to expand the same resources and assistance into those markets, it's really the same function. It's still their hometown medical team, and it's still this caring nature. And the beauty of it is these physicians in those markets, that's their heart.
Yes, it is.
And
absolutely.
The hurt of it is if they don't have the support from a hospital-based system to do so. And so it's really exciting to be able to move over, nearly an hour away and put our impact and imprint on I-35, knowing that we can support a greater effort of delivery of healthcare on a broader spectrum in that market that's recently been kind of put on hold, put on the bench. So I appreciate and give the accolades to anybody and everybody who's associated with Southern Plains.
Absolutely.
And we're excited to continue to hang our shingle one more facility location, simply because we feel like that's an impact where we can serve our communities in Oklahoma. And as you mentioned, this probably is not the last effort moving forward.
Right.
We're always have our eye on where we might serve next.
Absolutely.
And if the resources and people are there to join arms. We're just locking arms with great people.
I think it's really cool, the business that you're in, because I see your heart and I see your team's hearts, because taking care of sick and injured, that's the most selfless thing I could ever think of. And our team does that on a day in and day basis.
Yeah.
But it's a business too. And you've created the new model that's working in rural healthcare that seems impossible for 600 other healthcare facilities across the United States. And to be able to have that here in Oklahoma from a company that was founded here in 1915, a pure Oklahoma company, rural Oklahoma, and you're going to grow this type of model, and we can spread that out through Oklahoma.
Exciting.
It's very exciting, man. Thanks for your time.
It's Easter every day here.
Yes, sir, it is.
Thank you, Al, for your
Absolutely.
time.
Thank you, man.
Appreciate it.